Tylenol. What is it? How does it work? And does it cause autism? In this video, we're going to answer those questions using basic MCAT concepts. Well, first of all, what is it? Tylenol, aka acetaminophen, is a widely used painkiller and fever reducer. And it's commonly given to pregnant women as a painkiller because other pain relief agents such as ibuprofen or opioid medications are known to cause unwanted side effects in the fetus, whereas Tylenol at recommended doses is generally safe. So how does Tylenol actually work? Well, it's a competitive inhibitor of the enzyme cyclooxygenase, which is an oxidoreductase enzyme that normally converts the 20-carbon substrate arachidonic acid into prostaglandins, which are local signaling molecules that actually mediate processes such as inflammation, pain sensation, and increasing body temperature through paracrine signaling or local tissue signaling. When Tylenol is present, it can actually bind and block the active site of that enzyme, thus preventing the arachidonic acid substrate from binding and preventing its conversion into prostaglandins, therefore reducing their levels. An important caveat, however, is that it is not very active in the periphery, so outside of the brain. And that means it's not a very good anti-inflammatory agent. It won't really reduce things like swelling or redness, but it will be very effective at reducing prostaglandin formation in the brain and therefore reduce fever and pain perception. So the million-dollar question is, does Tylenol cause autism? And the short answer to that is no. The longer answer is that even though we can never be 100% sure in science, we can use the available body of evidence to make reasonable conclusions. So let's do that. So one of the studies that could be used to support the notion that Tylenol causes autism is a study from 2025 out of Mount Sinai, which is a systemic review that actually examined 40-odd cohort studies that were looking at whether there's a neurodevelopmental link between Tylenol and autism, and essentially looked at their methodologies, and they concluded that those that were higher quality with better methodologies were more likely to report a link between Tylenol exposure and autism. However, all of the studies they looked at were observational in nature, so they could not prove causality inherently. Furthermore, they were predicated on self-reported data, which is not very strong, and they could not effectively control for confounding factors such as maternal infection and other things. So while it's an interesting study, it is by no means definitive. Then there was another study actually from 2024 out of Sweden, which looked at a huge sample size of children, over 2 million, and basically traced back to see whether or not they were exposed to Tylenol in utero and whether or not they were subsequently diagnosed with autism. And upon initial analysis, they did see a slight marginal increased risk of developing autism if you were exposed to Tylenol. However, when they controlled for genetics as well as environment by doing a sibling control analysis, they found no difference, so no link whatsoever. And then there was the Childhood and Pregnancy Prospective Study, which is out of the US in the 1960s, an older study. And this one followed over 55,000 pregnant women and their children to see whether or not there was a link between exposure to certain drugs such as Tylenol and development of autism and other conditions. And after controlling for confounding variables, they found no causal link between the development of autism and exposure to Tylenol. If you or someone you know is pregnant and you have a headache, please do not hesitate to take Tylenol.